Hi, it's Dr. Fox, licensed psychologist in the state of Texas, and this video is going to be rather unique, and in that we are going to talk about BPD and psychopathy, and we're going to really kind of do a deep dive in this video. One thing I do want to explain is that I think that this confusion, and certainly the confusion associated with BPD, there's also a lot of confusion associated with psychopathy. And I think when they're pulled together, I think that people really lose touch with what these two disorders are and what they look like and the likelihood of them co-occurring. So that's what we're going to unpack today. We're going to do a deep dive. We're going to talk about the 2 factors and 4 facets of psychopathy and how potentially each one could or could not or does not relate to psychopathy. A lot of the information that I'm going to be telling you is from the research. You can always look it up, like on Google Scholar, things like that, which I think is really good to do because I think that the research and the genuine information helps to clarify this. This is, I'm going to be honest with you, this is one of my pet peeves that people say that, oh, well, you know, people with BPD, they're all psychopaths. That's absolutely not true. There are no alls, right, in human beings, right? We can't say, oh, well, they're all like this, they're all like that, things like that, okay? So we're going to break that down. And we're going to do that by certainly talking about that. We're going to talk about overgeneralization of BPD, as well as colloquial use of the term psychopath. And then again, we're going to go into the 2 factors, 4 facets of psychopathy related to BPD. And then we're going to talk about, like, what can you do about it? If you've kind of internalized this view, if you've heard that online, read it online, seen it online, and if you have BPD, I think that puts people in a really bad position where they're like, well, here's something else that's wrong with me. Well, let's kind of break it down and let's get into it. Here we go. Like, share, subscribe, see me online, all that other good stuff. And here we go. So first, right, are those with BPD psychopaths? Exceptionally rare. Psychopaths are exceptionally rare. Genuine psychopaths are exceptionally rare. In my 20 years of working in various prisons, private practice, working with different individuals across different socioeconomic statuses, different parts of the world, things like that, I've only encountered one genuine psychopath. I have a friend who is a forensic evaluator, and she's been doing forensic evaluations for an exceptionally long time, and she has only identified 2 individuals that were genuine psychopaths. Now, the statistics are about 1 in 150 people, right, that are genuine psychopaths. And if you look in prisons across the world, the higher the security levels, you're more likely to find individuals that have or qualify for psychopathy. Not everyone who is a psychopath is in prison, right? But the complexity of BPD, I think that, and the tendency, not only of mental health providers, but of people in the general population, the community, tend to really overgeneralize BPD to only recognize the upper third, which is the top extreme 3% of BPD tends to be what people conceptualize BPD to be. Like that little rhyme for you, but serious, right? Because what happens is most of the individuals, most of the clients that I have fall into that moderate range, okay? Now, I've come across, of course, individuals that were severe and extreme BPD, and they didn't even qualify for psychopathy, okay? So the extreme individuals whom I've worked with and the individual that I've worked with that had psychopathy would not have qualified and did not qualify for borderline personality disorder, BPD. So we have to be sure that what we're looking at is the accurate disorder. If we don't know what we're looking at, how do we work with it? How do we treat it? And I think that that's part of the problem. And if you look at the research, most of the research that's done on incarcerated individuals and BPD and psychopathy is done with incarcerated individuals. There's very few studies that are done on the general population to identify psychopathy because they're exceptionally hard to find. They tend not to participate in research studies. So what we're looking at is an incarcerated sample, which then, of course, is skewed, okay? And from that skewed sample, then we find subsamples of those that qualify for components of psychopathy, components of BPD, and then that research is then conducted. The problem, and the big problem that happens, is that research, people aren't doing that deep dive. They're not thinking about that. So what they do is they overgeneralize and say, oh, well, everyone with BPD is a psychopath. Whoa, first of all, no. Typically, people use the term psychopath in a colloquial term. When I use it, it is a clinical term. That clinical term is what we are going to talk about, those 2 factors and 4 facets. And it's a very, very serious disorder. It's a very, very complex disorder. And a lot of times, a lot of these individuals, their life is in constant upheaval. Now, we're talking about psychopathy. Now, those that are severe or extreme BPD often have very chaotic lifestyles, right? A lot of times things are often in disarray and things of that nature, but very different. Now, this is why it's so important that we focus on core content, which I talk about in all of my videos, and surface content. The core content of that BPD individual is because of that lack of connection. It's because of those fears of abandonment. That's feeling invisible, feeling unheard, feeling disconnected. Whereas your psychopath, that the core content is often about power, profit. It is often about how to take advantage of others, often about very stimulus response and aggression. But there are components underneath that, and that's what we're going to get into here. So first, let's talk about factor 1. Factor 1, okay, and we're going to talk about facet 1, okay, which is interpersonal, the interpersonal components, okay? So it's glibness and superficial charm. And that glibness and superficial charm, what we see is you're kind of like, yeah, whatever, you put yourself out there, is that you're trying to connect to others. You're not really maybe good at it, maybe a little bit here or there, but not great. And you put this sense out in order to connect to others, to convince others to do things that they wouldn't normally do, that you want them to do, so that you can take advantage of them, so that you can get your needs met. And I think that is your psychopath. Now, that's one component. There are several components that you need in order to qualify. This video is not about diagnosing psychopathy. It's not about diagnosing BPD either. This is about just getting an understanding about how these two are so different, and that people with BPD should not grab on to this idea that, oh, well, if I have BPD, I'm a psychopath. Please don't believe that. Please push back against that. That is a misuse of both of these terms. Okay, so let's go back to that glibness and superficial charm. So for your BPD, now BPD individuals, they're going to have an array of social engagement skills. Okay, could they have a superficial charm? Maybe out of a need for connection to others. They may engage in promiscuity, right, or in particular behaviors in order to feel attached to others, to pull others close to them. That glibness, we're not going to see too much of that. So I think that you're not going to see much glibness, superficial charm in BPD, whereas you see it in psychopathy. Another facet, interpersonal facet of psychopathy, is grandiosity. Now, grandiosity, right, for individuals, that fall into that psychopathic category, you're going to see that they often, really sort of accentuate their skills, their abilities, who they are, what they can do, and things like that, because they want to impress you. You know what I mean? And then, but I think on the other side of that, BPD, that grandiosity, you don't often see that, right? You don't tend not to see individuals with BPD that are like, I'm so great. There's nothing that I can't do, right? And even on the other side of grandiosity that you may see, which in those with BPD, is that sort of that grandiose sense of pain, of suffering, where they're like, well, no one suffers as much as I do. No one is at this loss as much as I am. And I think you may see that. And when we talk about grandiosity, we're talking about the extremes of the expressions of those behaviors, okay? So grandiosity is very different, very unique in those with BPD, and exceptionally different, just in my example, right, of those that fall into that psychopathic category, as opposed to those that are along the BPD spectrum. Next, we have pathological lying. Now, this is where we may see some sense of connection, right? Which is, now you're individual that falls into the psychopathic category, they're going to lie to take advantage. They're going to lie to get what they want out of you, usually to fulfill this need of power and profit. Those with BPD that have a tendency for lying, for misrepresenting themselves, they may engage in that, but it's typically to emotionally connect with others. It is out of this great need to not be alone, to not feel as though they're in the middle of the desert and they have no water to drink, but it's an emotional water, right? And so they are almost starving for that attention. So then they put out these phrases, right? This lying of who they are and this misrepresentation, which lying could also factor into that unstable self-image. So they don't really know who they are or what they believe. And that's part of what's causing that confusion. So there's a greater degree of complexity, but when we're just talking about these factors, there is a bit of overlap here, right? That both may engage in pathological lying, but this is why we have to look at the core content, not just get caught in the surface. Oh, pathological lying, check, there you go. No, there's more to it. These are complex disorders, okay? So we have to look at them from a much deeper frame. Next, let's talk about conning and manipulative, right? Now, you can see both of these in those with BPD and those that fall into the psychopathic category. Conning and manipulative, again, goes back to, right, those motivations, those underlying factors. For those that are in the psychopathic category, you're going to see that they're doing this, again, to take advantage of others, power, profit, presenting in a particular way, right, that puts that person close, that puts that person at ease, and then they take advantage of that individual, typically monetarily, sometimes it is physically, and then in order to get their particular needs met. Now, on the other side, for the BPD individual, a lot of that manipulative behavior is, again, to try to pull people close so that they don't feel alone, so they don't feel rejected, so they aren't abandoned. And it's this internalized fear. And it's this internalized fear of abandonment, rejection, the sense of being unnoticed, unheard, unseen. I think we're talking, again, different core contents, different approaches or goals with that connection. Okay? And that's part of, even though there are similarities, there's great overlap in what drives it. And that's our facet one of interpersonal. Okay? Also, under factor one, we have interpersonal and affective. Now, facet two is affective. Okay? So facet two, the first one, what we're going to talk about is lack of remorse or guilt. Now, here I think we've got very distinct components here, right? We have two ends of the spectrum, okay? So here, right, you have your psychopathic individual, right, who falls into that category. And that lack of remorse or guilt, because they just don't care. They don't care what they take from you. They don't care how much they hurt you. They don't care how much you suffer. They don't care how much you've lost. As long as that need for power and profit is fulfilled, and that need for them to feel this sense of power, this sense of control, right, and them getting what they want. They don't feel bad about it at all. Zero. Zilch. Okay? But when we talk about those with BPD, what we're talking about is lack of remorse or guilt. Here, it may seem that way. And I think that sometimes that's that surface content. It's like, oh, they don't care. But on the inside, and all the clients that I've worked with, it's intense, internalized remorse and guilt. Now, they may initially behave in ways that appears as though they're careless, right? That they don't recognize your boundaries. They don't care about your boundaries, right? They're texting you all the time, calling you all the time, showing up at inappropriate times, things like that. You're like, they don't even care. And I think that's part of the pathological components associated with BPD. And it's very different. They may present with a lack of remorse or guilt. However, I have found that they experience intense guilt and remorse about their behaviors, about their drive for self-destruction, about their engagement in these maladaptive patterns that really cause continual upheaval in their life. Now, the next one under facet two, we're going to talk about emotionally shallow. Now here, for those individuals that are in the psychopathic category, being emotionally shallow is that there's just not a lot of water in the pool, right? There's a saying, and I'm not being derogatory, it's more for example, is that, emotionally deep is a puddle, And I think for those individuals that are psychopathic, that fall into that category, that they just have this emotional shallowness. Like you get this sense that yeah, something feels wrong. Something doesn't connect here, right? You can see the sniffing, right? It's kind of like something doesn't smell right. Something doesn't feel right, right? And it's because they don't have that depth of emotions that they can pull from and acknowledge and express in an effective way that's genuine. Because a lot of times they have sort of a walled off sense of emotional response, okay? Whereas those with BPD are at the other side of that, right? Is they have intense emotional reactions, deep emotional reactions, and they are intensive. They are not emotionally shallow in any way, shape, or form. They tend to be very emotionally deep, which is that they have these deep emotions that they get, it's almost like a tsunami of emotions, right? Whereas you have a puddle for your psychopathic category, but you have tsunami-like emotions for those with BPD. So vastly different. The next one is callous and lack of empathy. Now here again, even though there may be some similarities, they're very different. Now the psychopathic category individual, that callousness and lack of empathy is that, again, they just don't care. They don't care how they hurt you, how they take advantage of you, right? What they do. It's that their parasitic lifestyle, which is an additional component we'll talk about in a moment, is that, they don't care that they're using up your resources, that they're eating the food in your kitchen, that they're using all the, your cable. They got your AC down to, 62, or the heat's up to 78, and you can't afford your electric bill. They don't care, so they're callous and they just don't care. They don't care about the situation you're in, and they don't have that emotional connection to feel that sense of loss. The other side of that is, if we look at those with BPD, that lack of empathy, I think sometimes they feel this intense sense of empathy. Now, those with BPD can often get confused, right, when empathy comes into play. It's a lot of times because it's a lot of emotions. It's a lot of sort of missing of that beacon of orientation, right, which is sort of empathy is we kind of know where we are and we feel empathy for someone else and what they're going through. I think for those with BPD, a lot of times I think that they have this confusion. This empathy is that I feel sorry for you, and I feel this sense of loss, and I feel this sense of confusion, and it's so intense that they get lost in it, so they don't convey it very well. And again, it's different for everyone. It all does depend upon the spectrum of BPD as to where they fall as well. But I think that what we see is that it is a lot of empathy. It is intense empathy, so much so that they could get lost in it. Very distinct. The next one is failure to accept responsibility for one's own actions. Now, I think here there is some overlap here. We're going to have your psychopathic individuals, right, that fall into that category. They're not going to accept responsibility for what they do, and they don't care how much you suffer. So, I don't know, too bad for you, right? Is kind of how they feel, and they go on to the next person to take advantage, and they continue to go on and engage in these maladaptive patterns that are often very fulfilling for their sense of profit and power that they need in order to fulfill and drive their maladaptive behaviors. Now, on the other side is failure to accept responsibility for their own actions in BPD. I think we do see that a lot. And I think that, but we see it very differently. And I think that we see that in that a lot of times it's this, again, this emotional turmoil that they get caught in. It's this difficulty to slow down, right, in order to contain those maladaptive patterns, right, in order to recognize their behavior and consequence. And sometimes other individuals fall into that scenario of the consequence, right, where you have to sort of, lack of a better way of phrasing it, pay for the result of that consequence of that behavior, right? Which is, so, right, is that person, maybe they do something, right? Maybe, you're at a restaurant and you get into an argument and they get, just really sort of expressive, so much so that they're yelling, screaming, throwing things on the floor, things like that, and then they stomp out. And perhaps this is a common maladaptive pattern, right? Behavior response in this individual, and you're embarrassed. So on your way out, right, you happen to pass your boss, and you see your boss there, and you're like, oh man, well, here we go again, right? And then you think that, and then so that person, right, they're outside and they're still letting you have it, right? They're still chewing you out. They're still, reacting because they're still in that reactive, chaotic, over-responsive phase of their initial activation, okay? So then typically what happens is eventually, and what I have found in many of my clients, and perhaps you've experienced something differently, is that then once they're able to settle back down, once they're able, in order to gain that sense of control, get that sense of insight, get that sense of understanding about what they did, and remember that this is different for everybody and where they are along their treatment. It's much more complex in BPD than it is in your psychopathic individuals, right? But oftentimes in the folks that I work with is that they fear this sense of responsibility because if they take the responsibility, doesn't that justify the other person leaving them? So they resist that sense of responsibility. So, but it's sort of paradoxical, right? Which is that if they say, well, if I take responsibility, then they'll leave me. But what happens is if you don't take responsibility, they're probably going to leave you over time. So what they need to do is you need to realize that I have to take responsibility for my behavior, try to contain it, try to control it so that I can have a better grasp of what's going on around me so that I can make better choices and use adaptive strategies to control situations. Notice the explanation is vastly different as well as the presentation. So that's factor one, right? And those two facets are interpersonal and affective. Let's talk about factor two, which is lifestyle and antisocial. So let's first talk about facet three, which is lifestyle. And this is need for stimulation and proneness to boredom. Now here in your psychopathic individuals, they are sensation seekers. They do need that level of stimulation, and they do require a greater degree of stimulation in order to reach that level of, let's just call it a level of satisfaction, right? Where they get that sense of need met, where they're like, yep, okay, I got it. So they need a higher sense, right, of stimulation in order to reach that level of satisfaction. Those with BPD, they tend not to really have that. They tend to have a very low responsive style, or that need for stimulation tends to be very low in my experience with these individuals, which is that they experience something and it becomes so intensive, right, that they may drive for that sense of stimulation, but that stimulation is more to be okay, to feel connected to someone, to feel heard, to feel recognized. Very different, okay, as opposed to the psychopathic individuals. Very different components. The next one is a parasitic lifestyle. Now, when we talk about parasitic lifestyle, what we're talking about, these are individuals, right, for your psychopathic category individuals. This is somebody who, they're like, oh, hey, can I just sleep on your couch for a few days? And then 4 months later, they're still there. They don't have a job. They're taking complete advantage of you, right? They're turning the air down. They're eating your food, right? They're doing all that stuff. And they just don't care. And they're just taking and eating off of you. It's parasitic. With BPD, I think that you could say that there may be an emotional parasitic component, which is that emotionally, right, they're always pulling from you, right? That they're always pulling this sense of emotion from you, this emotional response that they need to be okay. But very different. We talk about parasitic lifestyle. Here we tend to have more of items, goods, materialistic issues, as opposed to over here. You could say that it's an emotional parasitic component, but again, because it's the emotional component, I do think that it is inherently different than what that parasitic lifestyle when we talk about the category associated with factor two and the facet of lifestyle is vastly different. So we're talking about there's some similarities there, which is why I think it's important that we contrast the two for this particular one. Now, the next one is a lack of realistic and long-term goals. And I think here, sometimes we do see some similarity here for those with your psychopathic components, right, that fall into that category. They live day by day, right? They're not planning for the future. They don't have 401ks. They're not saving for tomorrow, nothing like that, because they're just living it. I'm living to get my needs met right now, right? To get that high sensation-seeking need stimulation satisfied, right? And to keep on going, and I don't need to plan for tomorrow because many of them hold this idea that I probably won't live till tomorrow. So I might as well take advantage of everybody today. Whereas I think those individuals with BPD, I think sometimes there is a lack of realistic and long-term goals, but I think sometimes it's more of a difficulty planning for the future, understanding how to plan for the future. It's a lack of hope. It's these depressive spirals sometimes are very long. They can be very intensive. A lot of times there is, of course, comorbid conditions of major depressive disorder or bipolar 2 disorder that also occur with BPD. That's also very common, right? You don't see that in those that are along the psychopathic category, that fall into that category. So it's very different. So that lack of realistic long-term goals, I think it's a difficulty planning. It's a lack of hope. It's a lack of kind of faith in themselves that they can control their condition, move forward, and succeed. Next is impulsivity. Now, here's where we're going to have some overlap, right? Is that both of these individuals engage in impulsivity, which is that there's an initial activation, right? And they engage in maladaptive behaviors in order to control the situation of what's going on. And they tend to be very maladaptive and very destructive to self and others. So there is some overlap there, okay? All right? And then we have irresponsibility. And I think with irresponsibility, what we look at is, I think from our lens of sitting here, right, that you're watching the video maybe on your phone or your computer or wherever you are, and you said, oh, well, how could he or she do that? That's irresponsible, right? And then on your psychopathic side, what is going on here? That's irresponsible, right? There is a tendency for both to engage in behaviors that have long-term consequences that are pretty significant and pretty severe. So they can be very destructive. So there is this sense of irresponsibility. But I think that the issue with irresponsibility, when you look at your psychopathic category individual here, that irresponsibility, they don't care. And they're just like, doesn't matter to me because I'm getting my need met. I'm getting what I want out of this, and that's all there is to it. And I'll do whatever I got to do in order to get that need met. So eat it. Whereas I think that irresponsibility for those along the BPD spectrum becomes very much about poor planning. Again, a lack of hope. Again, a lack of being able for self-containment of a lot of those maladaptive patterns, realizing that they control their behavior, realizing that if you engage in behavior A, the consequence of B is pretty severe. So it becomes this irresponsibility, but not because of a lack of not caring, which I think is your psychopathic category individual, but that irresponsibility of being sort of lost and being sort of caught in this sense of confusion and misdirection. So I think in some ways that there is that sense of confusion, but they do both, right? We just got to call it that there is this sense of irresponsibility that we may see in both. But again, I think that it presents very differently. I think the factors are also very different as well, even though there are some similarities there. And then next, let's talk about facet 4, which is antisocial. And the first one here is poor behavioral control. Now, both of these individuals are going to show poor behavioral control, right? Your psychopathic category individual has a high tendency to be violent, could be passive-aggressive, depending upon their ability of self-control about what they can see in others and who they can take advantage of. So how socially skilled are they, right? That's your psychopathic individual. Poor behavioral control, I think, for your individual along the BPD spectrum. But again, I think that is more, goes back to our impulsivity, our irresponsibility. But that poor behavioral control is that it is this old maladaptive default behavior pattern that they fall into that is highly destructive. But they are driven to learn more effective ways of managing it and having a greater sense of control, whereas your psychopathic category individual doesn't care. And they don't care enough to participate or try to control it or anything like that. I just don't care. The next one is early behavioral problems. Now, a lot of folks with BPD don't have early behavioral problems in their history. Now, they may have emotional problems early on, whereas your psychopathic individuals, oftentimes they have callous and unemotional traits that are peppered throughout their history of development. Maybe they drugged the babysitter and they took advantage of the babysitter. Maybe they were killing cats. Maybe they were killing birds. Maybe they were engaging in all of these early behavioral problems in school, right? They're fights and bullies and taking advantage of others and things like that you don't see with those with BPD. They don't have those typically in their history, okay? Next is juvenile delinquency. Again, goes back to your BPD individuals are unlikely to have that. Now, they may have some, again, emotional components. You're going to see a lot of emotional issues, whereas those along your psychopathic categories, they're going to have those callous and unemotional traits, right, which drive them into these really aggressive behaviors, taking advantage of others, right, being destructive of others, property, taking advantage of others, and extreme, very intensive, some often violent in some cases, behaviors. Whereas for those with BPD, again, they tend not to have it. Revocation of conditional release. Now, this is facet 4, antisocial. Again, it's unlikely that you're going to see an individual with BPD who may be on probation. Now, that doesn't mean that some aren't. And I think when we go higher up the BPD spectrum, I think you may see some of those antisocial behaviors. We're not talking about antisocial personality disorder. We're talking about the extreme of antisocial personality disorder or traits, and that is your psychopathic category. That's what we're talking about. We're talking about the extreme here. There are individuals, right, that I think they are fledgling sort of BPD cases that later on, as they get older, they are going to have BPD. They do have a tendency for acting out. They do have a tendency for violence. They may have some of these issues. But again, it's going to be more emotionally driven than it is about power, profit, destruction, taking advantage of others. So there's a distinctive drive here. If they have been into sort of a juvie, right, juvenile detention, something like that, or they are on a conditional release, something like that, they are likely to revoke that conditional release, particularly and much, much, much more so if they have those callous and emotional traits and they are certainly falling into that psychopathic category, whereas those with BPD do not. And lastly, criminal versatility. I think that you're not going to see that with BPD. You're not going to see that level of sort of sophistication, I think, lack of a better word, that you see in your psychopathic category individual who is taking advantage of others, who is learning to become a better criminal, who is learning to become much more threatening, much more risk-taking in the way that they take advantage of others and the severity in which they do that. Whereas those with BPD, if they do get incarcerated, it tends to be more along sort of the mainstream, right, of, maybe they committed a crime, whatever it may be, or it's federal, state, whatever it may be. They commit that crime, but they tend not to have a lot of different crimes in the past. They all tend to be related and under perhaps one similar umbrella, whereas your psychopathic category individual is much more likely to have that criminal versatility. Could be theft, right? Could be sexual assault, could be computer crimes. Of course, I think a lot of psychopathic individuals are much more likely to have a hands-on approach or aggression to that acting out because of that need for stimulation. So we've gone over factor 1 and factor 2 and the 4 facets that fall underneath. And I think that it's really, really important that as you go through this, that you hear those differentiations. Yeah, there's some overlap, but these are 2 distinctive personality types. Very, very distinctive. And I think that it does all of us a disservice, particularly those in the mental health field as well, for those that are trying to get mental health, to inappropriately throw them all together and to say, well, people with BPD, they're also psychopaths. I think it does everyone a disservice. And I want to encourage you to resist, watching stuff like that, to resist internalizing those false narratives, right? Those false descriptors and things like that, and that BPD is a treatable disorder. Psychopathy is not. And you can look at the research, and the research over and over and over again shows psychopathy is not a treatable disorder. Okay? The research really supports that. BPD is a good prognosis diagnosis. And if you fall along the BPD spectrum, do not internalize that term of psychopathy equates to BPD, because that is a fallacy and absolutely not true. And I hope that you found this video helpful. Like, share, and subscribe. And I wish you all the best. Please take care. Thank you. Bye-bye.